Hello viewers, welcome to Socialpost Health. Today we have Dr. Arshita Singh is with us, orthodontist from Dentaire Dental Clinic, having a 20 years of experience. Let's welcome her. Hello ma'am, how are you?
Hello, I'm fine indeed. How are you doing?
I'm doing good, ma'am. Thank you for asking. Ma'am, if we see, many people tend to ignore dental issues. Like anything, they
Yeah,
don't
they
mind
do.
it actually.
They do. Approximately 95% of Indian population have some form of gum diseases.
Yeah.
And that number is scary. And 4.5% of them actually consult a dentist. So
Yeah.
imagine how many people are ignoring common dental issues that they have.
I myself included. I
It's
do that
actually
as well.
quite common.
Yeah. So what indicates and what are the symptoms that indicates one should consult a doctor? I mean dentist.
The first and primary problems that people walk into our dental clinic with our excruciating, throbbing pain that is radiating to the neck, to the ear, sometimes even causing headache. The other symptoms is swelling of the jaws, which may even cause restricted breathing, which is actually an emergency dental
Yes, ma'am.
treatment.
True.
So these two are the most frequent problems with which patient actually walk in. Other than that, people also come with bleeding gums. They have difficulty in chewing.
Yes.
They have clicking sound coming from their joints, crooked teeth. All of these are symptoms with which people walk into a dental clinic. The sad part is most of the dental treatments before becoming severe are silent. They show no symptoms like black deposits on the teeth. Then you have early stages of cancer. Yes, they are all silent. Even small incipient caries like which present as black dots on the teeth,
Yeah.
they are all silent. They have no symptoms,
No warnings.
no warning signs. But if you get it treated at this stage, the treatment is effective, cheaper, and you will not suffer from the excruciating consequences if you ignore these basic symptoms.
Yes.
So that's the sad part. Dental checkup is should not be a luxury, or you should
Oh.
not treat it as, I have a problem, I should get it treated. It should be more of I should get it treated before the problem even develops.
But in
Preventive
India,
oriented.
but in India it won't work
They
like
don't.
that.
They don't. People come even when people, while they have deposits, few people are really conscious and they do walk in.
Okay.
And we explain, look, you have incipient caries in here. Incipient caries are just few that are just beginning to form.
Okay.
You can cure it with fillings. They ignore.
They ignore.
And then they come when they have severe pain.
Yes.
So a small, easy treatment which could have been done with a simple filling goes to
leads
root
to, like,
canal
more
or
push.
extractions or
Yeah.
becomes quite severe.
So at the time, what will you suggest them when
What-
they come, like in that certain situation?
We cannot blame a patient for coming late in such cases when they come with excruciating pain. Our main job is to calm the patient down, treat the immediate cause of pain. We prescribe them with antibiotics and painkillers, but we insist that the underlying treatment has to be done.
Yeah.
Painkillers can take care of the pain. They are not removing the cause of the pain.
Yes, yes.
And the cause of the pain needs to be treated. So we suggest root canal treatment or extractions based on the problem that they have.
But why in this generation these problems are occurring so often? Previously, we don't heard anything about these things.
Previous generation also faced the same problem, but they were very reluctant to go to a dentist. They were okay with using normal homemade remedies to cure their pain. That's fine. But when they are coming to us now in their 80s or 70s,
Yeah.
late 80s, there is hardly anything we can do except pull the teeth
Okay.
out and give them dentures.
Yes.
Nowadays generation, though they are aware, for them the treatment is mostly cosmetic. They see crooked teeth, they want a quick fix. They want, just put veneers or something, or just give me a detachable smile.
They're very cautious about it.
Very conscious about it, but they don't want to get the proper treatment done. Like if you have crooked teeth, the proper treatment is orthodontic correction. They
But
are very
it will
reluctant
comes-
to get it done.
Yeah, doctor, but it will comes under the cosmetic things, right?
No, orthodontic correction is not cosmetic.
They
It's
think
functional.
like that. Yeah, but
This is what I want to actually be very firm about. Do not consider orthodontic treatment as just getting a pretty smile, just getting a good smile for photographs. No, it's a functional correction. There are several problems associated with
yes,
malaligned teeth or crooked teeth that needs to be corrected.
true.
They will lead to further consequences, both in the oral cavity and systemic.
Yeah.
But people tend to ignore that. So please do not consider orthodontic correction as just getting a pretty smile.
Yes,
It should be corrected for your functionality, for your emotional and physical well-being. It's a combination of everything.
True. What long-term health problems can arise from misaligned teeth?
Now, this I have to explain because it's just not about getting, as I said, just not about getting a pretty smile.
Yeah.
It's more functional. Starting from the basics, from what happens to your teeth if you have crooked teeth
Yeah.
or malaligned jaw, is first you do get periodontal issues, that is gum diseases. You get deposits formed between the crooked teeth, like if your teeth are placed like this or forward or backward like that. These areas are very difficult to clean.
Yes, yes.
So you will have plaque deposits there, which will further damage the structural composition of the tooth. They will damage the bone, they will damage the tooth. Ultimately, you will end up with mobile teeth. Then you have these areas are prime for cavity formations. You will get dental caries formed over there. Since again, it's difficult to even diagnose that's present there,
Yes,
it
yes.
will progress to root canal. And later you would need to get those kind of treatment done.
Long consequences are
Yeah, they have consequences. Periodontal diseases have also been associated with systemic conditions. They are either known to exacerbate the condition or part of a causative, cause of that condition, like diabetes or heart diseases. All of this
I
is also
heard
linked.
about the heart diseases.
Yes,
Then
periodontal
how-
issues are because they are areas of chronic infection. The bacteria travels from these traps through their systemic blood circulation, enter the
True.
heart, and cause problem over there. So yes,
But people won't believe this. They won't pay much attention
no.
for this.
Incidentally, there is a rising case of sleep apnea or restricted airways. This also happens because of malposition of the jaw when you are sleeping, resulting in these problems. And sleep apnea itself has their own consequences when you do have obstructive airway diseases.
Yes.
They are also known to cause problems with digestion. Can you believe that?
Yes.
Because people generally believe digestion starts from the stomach. No,
Yeah,
it
stomach.
starts from your mouth. If you're not breaking down the food particles into tiny particles, mixing it well with the saliva, it hinders your digestion and also cause digestive disorders.
I mean, you're saying that chewing food, it also depends on the alignment of teeth.
Yes, because if your teeth are not well aligned, you're not chewing it properly. You're not
Uh-huh.
breaking down the food into the tiny particles that it needs to be broken down into. Suppose you have a very forwardly placed upper jaw or forwardly placed lower
Yeah,
jaw
yes,
or
yes.
constricted jaws. You're not chewing your food properly.
cannot.
Yeah, you're just hardly chewing and swallowing it.
Yes.
So yes, it does
Okay.
cause other systemic disorders as well.
That's very informative, doctor.
Thank you so much.
Are there treatment options? Are there any treatment options other than braces to correct the teeth alignment?
I'm very happy you asked me this question because when you say people that you need correction, they come with the thought that only braces can do it.
Yeah.
And right now we are living in the golden age of orthodontics. There is
That's
a
true.
shift from metal braces, which are traditional and wire based, which need frequent tightening, to digital AI based treatments.
Invisalign.
Invisalign, clear aligners. Incidentally, 70% globally people are shifting to aligners.
Yes.
And that trend is very common in all metropolitan cities, Hyderabad, Mumbai, Delhi, Bangalore. So there is a lot of treatment options other than traditional metal braces. Because even in fixed appliances, you have ceramic braces,
Yeah.
which are tooth colored. Even the wire that we attach to it is tooth colored. You have lingual braces that goes on the backside of the
Yeah.
teeth. Okay, it's not visible. The downside is obviously the cost.
Yeah.
It's a little
Exactly.
expensive.
It's too expensive.
Yeah, it's expensive, and the tongue needs some time to get adjusted to it because it has that adjusting time frame with the lingual braces. But clear aligners is clearly the game changer. Clear aligners are actually transparent,
Yeah.
removable trays made with polyurethane, which is a medical grade plastic.
Yeah.
And they are customized with a 3D intraoral scan. You wear it for
I mean, you will be sending the reports to the lab.
we will be sending it to the Invisalign company.
Okay.
Okay, where they are analyzed and based on AI technology and the orthodontist recommendations, you get
They will design it.
Yeah, you get the proper design. First, we will show you how it was and how it's going to be throughout the treatment procedure.
Okay. Okay.
And then once the patient approves, once the patient is happy as to how the treatment is going to look, how their face is going to change, and they are convinced, okay, I want to go ahead with it, that's when we send it for fabrication.
I mean, like, how does it work?
The aligners move the teeth into the required position based on the flexibility that they offer. And when you change each aligner, the tooth moves according to the aligner to the desired position. Aligners are extremely comfortable, more than traditional braces. They are good in maintaining oral hygiene. Since they are removable, you
Yeah,
remove
exactly.
it, you
They
can
are
brush,
removable.
floss, and then wear it back. Again, with aligners, you don't have any dietary restrictions. Like if you wear braces, we advise you not to eat anything hard, not to bite into anything, because it has a chance of dislodging your brackets, the braces. But
Do
with
they get
aligners,
stain?
pardon?
Do they get stain?
The aligners?
Yes.
You are changing it every week or every 2 weeks, so they don't.
They do actually, right? And I have
No,
seen
the
some
retainers
cases.
do. That's why
Okay.
retainers need to be changed every 6 months to 1 year. But aligners don't. You change them that frequently.
Okay, okay.
Okay, now previously it used to be 14 days aligner wear. Now it is 7 days. In 7 days, it's not possible for it to stain so much.
Yeah.
And they are virtually transparent. It's very difficult to make out. So it has that advantage as well.
Okay.
Perfect for adults, celebrities, and people who require moderate to mild corrections.
Okay.
But for severe corrections, you always have to go for traditional braces.
I mean, how long it will take to correct our teeth?
If you go for traditional braces, the general time is 18 months to 2 years. Sometimes it may be even pushed to 3 years because the treatment is that long.
Yes.
But with aligners, max, it should be done in 6 to 9 months.
Wow. That's wonderful.
Unless the case is very complicated or we are doing it for teenagers, early teens who we start the treatment with, and we have to carry it until all their permanent teeth come in proper position.
When people choose Invisalign, they need to prepare for any complications? No.
Invisalign hardly have any complications. Sometimes mid-treatment, the aligner may not fit well, but then you can again get a scan done, send it, and you'll get aligners from the point that you are stopped at.
They have to pay it again?
If you are coming under they are like, Invisalign has 3 modalities, okay? One is classic, one is moderate treatment, and one
Okay.
is comprehensive cases. Moderate, for 2 years you can get free aligners. For comprehensive cases, for up to 5 years you can get replacement of aligners. So yeah, so you can get it changed without any additional extra cost that you're initially paying.
Yeah.
It may be just for scan cost would be
Okay.
there, or about 1,200 to 1,500 initial cost of the delivery charge.
Can you give me the figure of cost of Invisalign? The
Invisalign
price.
cost in India starts from anywhere between 1.5 can go up to 3 lakhs.
3 lakhs.
Depend
Yeah.
upon the case.
People are not ready to spend 2 to 3 lakhs for their teeth. Here in India, most of the people.
We have local aligners as well that offer cheaper options. But you will not get the as good as result that you expect with
Okay, okay.
Invisalign. But the local aligners are doing well indeed. If we do it for mild to moderate cases, they are giving good results as well. So yeah, you have
They can opt for that as well.
local aligners starts anywhere between 50 to 60,000, goes up to 1.5
Okay,
lakhs.
that
So
comes in the
yeah,
budget.
yeah, it's quite within the budget. You do
Yes.
sometimes have EMI options as well. So yeah, it does come under the budget. It all depends on what your dentist suggests and what you choose.
Yep.
Thorough diagnosis of the case is much more
Yes,
important.
true.
For complicated cases, even if you wish aligners, we may not be able to give.
Oh, okay.
So that time we would have to say that you're not going to get the desired result.
So
Aligners
choosing
cannot.
the patient
So
is
choosing the
also
patient is also
matters.
important. Yes.
Yep.
So not all cases. It's not one shoe fits all. That is not
Doctor
the case.
has to
It
decide.
has to. Doctors can give you options.
Okay, okay.
Because even with the metal braces, as I said, you do have ceramic braces, you have self-ligating
yes.
braces, you have lingual braces. We can give you options.
So many variants are.
Yeah, you can choose and pick.
Doctor, what is the difference between aligners, invisible aligners, and braces and veneers? Which option is suitable for whom?
Now for these three, we need to categorize it into two categories.
Okay.
One is an orthodontic treatment, wherein you get braces and aligners. The other is cosmetic, under which comes veneers.
Okay, okay.
Orthodontic treatment is functional. It is physically moving your teeth into the desired position. Veneers is just a mask up.
Yep.
Okay? Now, coming individually to each of them, braces are actually fixed, cost effective,
Yeah.
time tested, can be done for mild to moderate to complicated cases as well. The whole treatment is under the control of the doctor. Yes, initial wear, it's uncomfortable for the patient. Getting accustomed to it is a little difficult. But once you do, traditional braces are a very good option. Aligners, as I just said, are removable
Yeah.
trays. They come under the control of the patient. It's completely based on patient compliance. You have to wear it for 22 hours a day.
Oh, 22.
Less than that, the treatment is not going to be what you expect it to be. There may be no tooth movement.
No, while sleeping also they need to wear those.
It has to be worn for 22 hours a day.
Okay.
Only removed for brushing and eating.
Okay.
You have to wear it
It's a
for
big
at
task.
least 20 to 22 hours a day. You have to change it every week on the dot. That is there. And sometimes the aligner, between the treatment, the aligner may not fit.
I mean, do they need to consult a dentist weekly?
I tell my patients that if they are based in Hyderabad, visit me every week, every month.
Okay,
So that
okay.
I can assess if the treatment is going according to the plan. But some patients do stay abroad or out of station.
Yes.
For them, it's very difficult to visit me. But then if the treatment is going smooth for them, fantastic. I will see them at the end of the treatment. But if it's not, then they would definitely need to come back and consult me again, which very rarely happens with Invisalign.
If the commute is possible, they can come in.
Yes, I would suggest please visit your orthodontist every month so that they can assess everything is going well. If there are deposits, we can clean, maintain your gum health as well during the treatment. If some tweaks are required, we can do that as well.
That's a benefit.
Yeah, because you have to understand that even though you're wearing the aligners, the treatment has always should go according to the plan.
Okay.
And then orthodontist understands the plan better than you can by seeing the slides and okay. And
What
you
is
don't
happening
even
there?
Yes, you don't even concentrate on whether the treatment is going right or not.
Yes,
so I will say every treatment has to go through your orthodontist.
Okay.
Okay, I will never suggest go for aligners without consultation of an orthodontist or without showing your orthodontist, without them saying that you do need aligners.
Okay.
Let them give you the option.
Yes.
Your case may not even fall under the aligner treatment.
True.
So it's always necessary to consult a doctor, let them suggest or give you treatment options and then go.
Yes, yes.
So that is aligners.
Aligners.
Veneers are cosmetic.
Yeah.
If you want to change the shape of your teeth or if you find them with minor crookedness, breakage or anything, veneers are a perfect option. They cover minor gaps and they give you a straighter smile. But for veneers as well, you should have a good bite. The
Okay.
overlap of the teeth should be good. You should have reasonably well positioned teeth.
Okay.
Veneer is not a magic wand that can give you a perfect smile overnight.
Do you people check those things?
Of course, you should be a case wherein veneers is going to help you with minor correction. But if your bite is not right, we cannot give you veneers.
Okay.
Veneers are thin. It's like you stick something onto a wood, like a veneer. The same thing happens. We remove a layer of enamel and then stick ceramic or
I mean, how do you identify the correct patient for the veneers?
we do a checkup. We check their bite. We check what they are seeking veneers.
Okay.
All right. If there's just minor discrepancies and you want veneer to correct that, great. But if there are huge gap between your teeth, if your periodontal health is not nice, if your bite is not right, we cannot give you veneers.
Okay.
We need to correct the underlying cause. So yeah.
Yeah,
In layman terms, if I have to explain what veneer and braces are, orthodontic treatment of braces or aligners is rewriting a complete book.
Yeah.
Veneers is just like changing the cover of the book.
That's true.
Making it more beautiful.
Discovering with a concealer.
Yeah.
Like that.
Yeah,
right?
it's like a concealer.
It's like a concealer. Yeah. Doctor, at what age should dental problems in children be identified? What are the benefits of early treatment?
We actually follow a global protocol given by the American Association of Orthodontics to get children as early as the age of 7
7.
get an orthodontic evaluation done. I understand at the age of 7, the children have both mixed and like you have milk teeth and permanent teeth.
Yeah.
But this is a very good age. We will not necessarily start treatment there, but we can predict how your jaws are going to grow. If there's going to be jaw discrepancy, we can predict crowding that may happen when the child is going to grow. We can diagnose or what you can call that, we can identify any habits that the children have, like thumb sucking or tongue thrusting, which is an abnormal way to swallow. Or if you have mouth breathing, all of these causes orthodontic complications
How
or
can you see those
orthodontic
things,
problems.
doctor?
Thumb sucking is
That's true.
very
That's
easy to
fine.
diagnose.
That's okay.
It affects only in the premaxillar area. You can see the thumb marks, the marks on your fingers. That is easier to follow.
Remaining things.
Mouth breathing. So premaxilla is just the front part of the upper jaw, wherein you put your thumb, the child put their thumb and suck.
Yeah.
So causing most of the malalignment over here in the front part of
doctor. Yeah.
the teeth comes forward. Thumb sucking is that. That's how we identify it. Coming to mouth breathing, with an X-ray, it's very easy to identify the patient is having some narrowing of the maxillary arch, which is causing breathing difficulties. And there are obviously dental parameters that we check to know that the patient is a mouth breather. Thumb sucking is very easy. You just open your mouth
You can easily
and
identify
ask
them.
the patient to swallow, and you can just see if the patient is thrusting the tongue between the teeth and pushing the teeth forward. In that case as well, both the upper and lower front teeth flare up like this. So all these things we have where we can identify what habit the patient has
Easily.
and correct it.
Yeah.
At that age, we have a list of appliances that we can give to the patient to correct these habits before they start causing problems in the later stage.
Okay.
So that's the reason why I would request all parents who are watching this to please get your child checked at the age of 7. And keep getting them monitored every year so that we can predict and correct orthodontically with appliances before you need extensive orthodontic or facial corrections.
Okay. So our teeth alignment designs it will define our facial structure.
Of course they do.
Is it true, doctor?
They do.
Okay.
When you have forwardly placed teeth, your lip goes back. It affects the development of your cheeks, your jaw.
Okay. Yeah.
All of that is all
Completely
interrelated.
looks abnormal.
Yes. See, we cannot do anything once the growth stops of the jaw.
Okay.
All right. But if you come early, if you seek an orthodontic treatment early, we can actually use the growth to correct jaw discrepancies. We can prevent the upper jaw from going more forward. We can prevent the lower jaw from going more forward. Okay, we have a lot of appliances
Okay.
which
Okay.
we use to correct the jaw discrepancies, preventing maxillofacial surgeries later in life.
Yes, exactly. Yep.
So if you catch it at a right age, get the right treatment done, you may avoid extensive orthodontic treatment later.
Yes, yes.
So that's why please visit a dentist at the right age.
Yes.